Hello, my name is Haley Vo, and today my presentation is how ADHD affects women and girls. So for the agenda today, we will be learning about what ADHD is, the symptoms of ADHD, the causes of ADHD, the diagnosis, treatments, and how ADHD affects women and girls. And we're also going to look at a small statistics. So the question is, what is ADHD? Well, ADHD is an attention deficient hyperactive disorder, ADHD, which is a brain disorder that affects how you pay attention, sit still, and control your behavior. It happens in children and teens and can continue into adulthood. The most common mental condition among children is ADHD. It is more common in boys than it is girls, since boys tend to show a more hyperactive disorder than girls. It is commonly detected in a child's early school years when he or she begins having difficulty paying attention. ADHD is not curable or preventable. However, early detection of ADHD as well as a good treatment and educational plan can help a kid or adult with ADHD manage their symptoms better. So, ADHD symptoms in children. So some symptoms in children, they have an inattentive, which means that they are easily distracted. They don't seem to be listening. They don't pay attention and make careless mistakes. They forget about daily activities. They have problem organizing daily tasks. They do often lose things and they tend to daydream a lot. While the other one is a hyperactive impulse, which means they often squirm, fidget, or bounce when seating. They don't stay seated and they talk excessively. They do have trouble waiting for their turn to answer questions, and they do interrupt others a lot. So some symptoms in adults actually change as a person gets older. So sometimes they're often late or forgetting things. They have anxiety. They have a low self-esteem. They have problems at work. They are impulsive. Some substances could be misused or have an addiction. They do procrastinate a lot, and they do have depression, relationship problems, and mood swings. So some of the causes for ADHD, we aren't necessarily too sure. Experts aren't sure what causes ADHD, but several things may lead to it, including genes. ADHD does tend to run in families. Chemicals, maybe the brain chemicals in people with ADHD may be out of balance. Brain changes. Areas of the brain that control attention are less active in children with ADHD. Also, what contributes or may lead to would be poor nutrition, infections, smoking, drinking, maybe substance abuse during pregnancy. Also a brain injury or a brain disorder, really. Damage to the front of the brain called the frontal lobe can cause problems controlling impulses and emotions. So some diagnosis for ADHD is ADHD can be difficult to diagnose, especially with children. No one will be able to detect it with the test after discussing symptoms with the child, the parents, and the teachers. And after witnessing the child's behavior, doctors diagnose ADHD in children and teens. To confirm a diagnosis of ADHD or learning differences, a child may take a battery of tests to check their neurological or psychological status. Some tests may include a medical or social history of both the parent and the child, a medical examination and neurological evaluation that includes vision, hearing, language, and motor skill testing. If hyperactivity is linked to another physical problem, more tests may be required to make sure they are fully diagnosing the child correctly. An evaluation of intelligence, aptitude, personal traits, or processing skills. These are often done with input from the parent and teachers if the child is of school age. Treatments for ADHD are often used with medication. Although there is controversy about the possible overuse, stimulants are the most commonly prescribed medication for treating ADHD. They can aid in regulation of impulsive, hyperactive behavior as well as the improvement of attention span. They affect brain chemicals like dopamine that can make impulsive behavior worse. Some medication that doctors mostly use are Adderall and Vyvanse. Okay, so how ADHD affect women and girls is our topic today. Excuse me. Women with ADHD are prone to eating disorders, obesity, low self-esteem, depression, and anxiety, but they do in the general population as well. These difficulties frequently manifest themselves in various aspects of their life. Versus men with ADHD, they may have difficulties at work, such as being unable to complete duties or become enraged with subordinates, whereas women are more prone to experience difficulties at home versus men. Um, some later diagnosis in women and girls. Women with ADHD are often neglected until they reach college, where they begin to exhibit a lack of self-control and self-management. Risk for them includes things like that, like being influenced by a sorority, and they are not as wild as guys are with ADHD. For women, it might be difficult for women to hide or control ADHD due to responsibilities, such as family and employment. There are, however, certain things that women may do to cope with the pressure of life. And here we see another graph just showing the difference between women versus men with ADHD. And then we see girls with boys with hyperactive impulses versus inattentive or combined. Okay, so on to our next slide, we're going to see ongoing research for ADHD. So over the past decade, the number of children being prescribed ADHD medication has increased substantially. Many states' Medicaid programs have developed prior authorization procedures for pediatric usage of ADHD medication in response to this development. These policies differ from state to state, and there are no comprehensive information on them prior. Nowadays, if the child has ADHD, the parent's insurance will cover at least some of the bill. The CDC National Center on Birth Defects and Developmental Disabilities supported large-based epidemiological studies of ADHD in the United States. These studies enhance what is known about ADHD and the co-occurring conditions in children and increase the opportunity to make the most informed decisions and recommendations about potential public health prevention and intervention strategies for children with ADHD. And here we're going to see our works study page where I got all my information from and resources. Alright, so we are at the end of my presentation. I just want to say thank you for watching my presentation. My name is Haleyville. I am taking Anatomy and Physiology 2302-394.